Okay, ladies and gentlemen, nice to be here with you today. For those who this is the first time with me, let me introduce myself a little bit. I practiced Chinese medicine in Taiwan 15 years and moved down to California 12 years ago and started my practice there. The reason I moved down is for my family, for my kids. But the best confidence that supported me to open my new career in a new country is my two foundations. First, the pulse diagnosis. Secondly, I strongly suggest you that you can try it sometime. It's the radio program. I host a radio program. It's not host. I was invited. I host a radio program in Taiwan for 10 years. I'm still doing it right now in California. I mean, in the Los Angeles area since the day I got here. I'm not doing commercial. It's not ads. I don't say my name. I don't. You know, in Taiwan, when you have a radio program, they are not allowed you to state your phone number, not to say the address or something. Just some common introduction to health maintenance or something. But they like it, and you can do it for your English-speaking radio or whatever. It's a very good way to get business. It's that's my two major support to give my confidence to open a new career, the pulse diagnosis and radio program. Now today we'll be talking about a pulse. My pulse system is very complicated, but today, I haven't finished. I've been teaching the pulse diagnosis for 30 years. Hi, internet. Okay. 30 years, and I developed my basic system many years ago, and I developed my 8 extra meridian system like 8 years ago something. It's very interesting from the help of my student and everything. I learned my pulse diagnosis from my patients. I didn't invent it or I didn't imagine it. And my method is a little bit different from your textbook in the school, whatever. And today we're not going to tell you how to take the pulse. We're going to tell you the pulse science, how to feel a pulse, what composes a pulse, significant elements listed in this world. This is a good one. Okay. And they'll give you a clear idea what the pulse is composed of and what we are looking for under our fingers. Okay? You can ask any question anytime you want it. Okay. 那你要介绍一下吗?
Okay, just to let you know how this is organized real quick. If you go to the very last page of the handout, the last 2 pages, you see a green one and a purple one, right? Those two I will mention to you as we're talking about those pulses to stick them in the proper lecture notes area. So we'll talk about the 2 color sheets later. But the sheet right in front of it that says index page, do you see that page? Looks like this. The 3rd page from the end. This is everything we're going to talk about today. All the definitions of these, I think 46 or 50 pulses. What they mean, where usually you would find them. Okay? And the category is listed there as well to let you know if this pulse is a shape, a jump, or a complete pulse sign, meaning it consists of shape, jump, and level. All right? And then the page number listed there is where you can find that pulse on this handout. So page whatever, like for example, the first one, the bean pulse, is a convex type of shape pulse found on page 2. So later on, whenever Jimmy talks about any pulses that you forgot or you haven't heard of, you can always go to this index and then go back to the lecture notes to find the definition of what that pulse means. Okay? So this class is really like a vocabulary class for you to understand the pulses. The next class, part 3, is where we're going to go into each specific 寸关词of the right hand and the left hand and give you what are most commonly found in those locations and then what are the herbal treatments. So that completes the 3-course series for this year, part 1, 2, and 3. So I would recommend you to put all the notes in this binder, part 1, 2, and 3. And then later when you go to the hands-on workshop, put all the patient evaluations in there too, because you are going to be in the class with another 30 people, and you will take all of their pulses. Each of you will have a diagnosis sheet of what your pulse is, taken by Jimmy, and then you will be taking everybody else's pulse. So that is going to be all emailed to you at the end. And then you can print them out and put them all in here. So later on, you can study it again. Because when Jimmy takes the pulses, he doesn't write down what the patients have. He draws them. So as you look at his drawings, you will kind of be able to figure out why he prescribes certain formulas and study from there. Everything is in one binder. Okay? So today's class, let's go over it real quick. The objective, and I'll go over the objective of today's course in a little bit. And then we're going to review what makes up a complete pulse as well. This is what we went over in part 1. And then discussion of pulse definition. So I broke it down into 3 sections. There are shapes, there are jumps, and there are levels. And the numbers listed behind them is how many pulses are in that category. Okay, so there are 10 convex shape pulses. So we'll talk about each one of them and tell you the differences and the similarities. And so on and so forth. Okay, so today's objective is be able to summarize the different pulses found by Jimmy, and then know if they are shapes, jumps, level, or complete pulse signs. We will have a little quiz at the end for you, 10 questions, just so that we make sure you get what we're talking about today. And at the end of the day, we have a special game that we want to play with you guys too, pulse diagnosis game. I'll tell you about that later. And then the third objective is to know the description of the pulses. And number 4, the general indication. What does straight pulses in general mean? Because pulses are not just straight. They could be bulging, they could be dented in, they could be tight. So they all have sort of a significant general meaning to them. Okay, so just know what they mean. Okay, so we'll start from here, back to Dr. Chang, about what are the 3 criteria. This is a review from the last class in Chicago. What makes up a complete pulse?
Okay, before that, let me say it again. The pulse diagnosis is so important because I don't know what the sequence in your office. In my office, when they come in, they don't tell you what's wrong with them. They don't say anything. They don't write down anything. They just sit there. I want you to find out. Okay, there are several different conditions in different clinics. First, generally, maybe the patient will tell you, "Hey, doctor, I have a headache." And I'm sure it's our responsibility to find out why he has a headaches or for how long or whatever. The reason for his headaches, and we take the treatment afterwards, after our decision has been made. But most of the time, they skip the first step. They don't tell you anything. They just sit in front of you, want you to find out what's wrong with them. The more you ask, the less respect they have for you. So my goal for the pulse the study is forced to find out the problem with of their body and the reason to cause their problem. So the final goal is don't ask. Finally, you find one day that when the patients sit in front of you, you don't have to ask. You just tell them. You tell them what's wrong with them. Then they will have a lot of confidence in you. They will take your treatment willingly, in a better way. Otherwise, they'll have so much doubt in their mind. Hey, you don't know anything. You keep on asking me so many stupid questions. How can I trust you for my health? That's why so many people cannot build their careers. In our system, we don't ask. We find out their problem, not by only pulses. We have to do ear signs and other kind of procedures in my diagnostic package. We'll be talking to you in other classes. But today, I'm going to explain the level, the kind of a pulse you will find under the fingers. We have time for those people who are new. And the first time with me, I'll be showing you how to, some hand method and let you review it, what's going on. But let's start with the 3 criteria that makes a complete pulse science. Actually, you can narrow down it to 2, okay? Can you see the screen from back? It's bright enough, huh? It's the shape and jump. So next time, when we do the checking with the patients, we have to write down the result or feelings on the paper, right? But usually I do with drawings. We'll be showing you a lot of interesting, very effective drawings, easy drawings later. Well, when we do drawing or writing our feelings, you must remember, everything should include this 2 items, shape and jump. So I've been emphasizing this idea for 30 years. If you keep that two items in your mind, then you won't be asking some silly questions. Because I've been through that too long. So what I'm asking, you must remember there are two things that compose the whole system. You can forget about level for the time being, but this, shape and jump. So next time, when the patient sits in front of you, and after you do all the examination, whatever, assessment or whatever, and you got a conclusion, then you check your conclusion. Does it include this two, the pulse size, okay? Include two items. Or, in the other way, for example, this guy is saying, hey, doctor, I have back pain today. Well, what's the reason for the back pain? It's our job to find out. Okay, you find out, the pulse is strong. One word is not enough. You should examine your result. Does it conclude these two items? If not, that means you're missing something. That's the point of this class, of today's class. You must keep these two things in mind. Otherwise, it's incomplete. And there's no way you can make any treatment plans according to that, because it's not complete. Unless you have the shape and jump all there, all written down, then you can do the treatment procedure. Shape. So how many shapes will there be? Will be in the pulse we'll be talking about today. That's the major concept for the design of this handout. You like it? You don't like it?
What I've learned about pulses.
The what?
Yeah. Not everything. What you learn in school about pulses is, thin, wiry, and deep, and slippery. And the positions. So Jimmy's system is all different from the school. There's some similarities, but maybe 20% only? Very little. So don't go back to your TCM thing. Just think of the pulses in an anatomical way, in a scientific way, in terms of physics, kind of like that. So if you're looking at jump, you must then determine what's the velocity. What does that mean, velocity aspect of jump? What is it? Speed, right? Fast or slow?
Frequency.
Right. And then strength. What is strength when you're dealing with a pulse?
Weak
the force.
or strong.
Weak or strong, right? How come some of you are looking at me like you don't know what I'm talking about? Oh, did you go to the part 1 class or review? Okay, let me write this down. Okay, velocity is speed, right? So this is when we're dealing with fast or slow. You can figure this out easily from the pulse.
We don't talk about that, man. That's not included in my pulse systems. It's just a science.
Forceful or weak, right?
This is very, very, very important, the second one.
Yeah, every single patient, you should be able to figure out if it's forceful or weak.
Then we'll be able to know the nature of his problem.
This is basically, excess or deficiency.
Yeah. Resistance?
Resistance. That's how the pulse hits your finger. Basically, do you feel the sluggishness of the blood inside the vessel? That's resistance. And that's totally Western medicine. I don't think is there such a thing in TCM when we study in school, the resistance of a pulse? We will talk about that too. There's 4 or 5 pulses, and they basically have to do with the greasy pulses. Okay, the viscosity of the blood is high, so the resistance is high. It feels not very smooth under your finger. And finally, the amplitude is the last criteria. And amplitude means how much does the vessel jump with each beat. The actual vessel, how much does it expand? And this one has to do with how much sclerosis or plaque on the vessel wall there is. There's more plaque, it's harder, right? So the amplitude is not going to be as high. But if you have a very soft vessel and you have a lot of heat, then you will see the pounding pulses that has a very high amplitude. So that's the basic distinction.
For example, if you have high blood pressure with high cholesterol and you're not taking medication, the resistance will be real high and amplitude can be low. But if the resistance is very high, it's very stagnant, I always use the word like I say, hey, your pulse is so muddy. Your body is so muddy. And the amplitude is so high, I like to describe it as expanding the pulse like that. Then this guy is suffering from some kind of a emergency condition, like urgent, might get a stroke or something. But if you don't have any high blood pressure, actually your blood pressure is low, and you can if your amplitude is low, that means you're weak or something. If you can create a very high amplitude condition, that means expanding pulse by drinking something. If you drink 6 packs, you definitely will have a big amplitude in your body. But anyway, we'll be talking about other things the whole day. That's all on these subjects. And what's next? It's level. Oh, yeah. Level is the how close the vessel is to the surface. How close, how hard you should try to feel the pulse. You can check your pulse now if you feel anything. Because sometimes, for those of you who are here first, for the first time, I'll be explaining to you the hand method a little bit later. But generally speaking, when we touch the pulse, we do it gently. Very, very light. Very, very light. Some people like to hold the patient's pulse like this. No. Don't let your fingertips turn white, because you have to be very, very gentle at first, like floating on the water. Because I just discovered a UFO pulse. You have never heard it before. Something floating in the air. Really, I'm not kidding. I'm not exaggerating. Something floating in the air. There's nothing under it to support it. So it is floating, flying in the air. So I'll call it UFO pulse. It's not a good sign. It's no root. So you have to be very, very gentle when you touch the skin. Otherwise, you'll miss it, definitely. And then you push down a little. Oh, I don't feel anything. Lower, until you feel something or something. So the level means the how close the artery is to the surface. And it means a lot. And it has a lot of pathological meanings. And we can do the treatment according to that. Floating pulse and deep pulse, they have very different meanings. Oh, hi, Simon.
Okay, so before we jump into the meat portion of the lecture, I just want to go over this real quick. We're going to first talk about all the shapes. So under the shape, the first category are the convex shape pulses. There are 10 of these pulses, and we'll talk about all these 10 until 10:30, the first break. This is an important category. The second category are the straight and wiry pulses. We'll talk about these 13 up until lunch. Okay? And then we will go into the concave pulses, shapeless pulses, all the different jumps and levels in the afternoon. That's how the breakdown of today's course is going to be. Any questions so far?
You look so puzzled.
Okay, for you, if you're new and you haven't reviewed the Pulsynergy Part 1 class yet, go review the positions, what they mean, and also where to put your fingers. Okay, we won't go over that today because that's already covered last time.